A leading philanthropic initiative for the Latino community has pivoted with a change of branding and focus, partly in response to developments around the pandemic. The Latino Legacy Fund, organized 8 years ago, has become the Latino Equity Fund with a focus on health disparities and needs for economic development. To tell us about the change is the fund's co-founder and co-chair, Aixa Beauchamp. Thank you very much for being with us, Aixa.
Thank you. I'm
Aixa,
excited to be here and talk about the fund.
and we have some catching up to do because I want to go back to when you started the older name, the Latino Legacy Fund. And talk about the central mission and the void that you were trying to fill.
So the Latino Legacy Fund started about 7 years ago. We started with a mission to just strengthen community and build greater civic engagement and philanthropy. And we focus on a number of issues that impact our community: education, preschool education, and more recently, workforce. And we raised $1 million and continue to raise money. But it was also difficult to convince others that not the community and not but other corporate and foundations that this fund was just doing more than just grant making. It has been since its inception a civic leadership fund where you have, about 15 Latino philanthropists and business people and community people really making not only doing the grant making for our community, which has a different flavor than when others do it, Chris, but also being an advocacy and a policy work. And so the COVID just, just accelerated that work that we did.
Because what I'm also intrigued here by is what happened even before COVID, because when Hurricane Maria went through Puerto Rico and did enormous damage, there was a big relief effort right here. What did that tell you about, I guess, the philanthropic impulse within the community?
We thought when we started the Mass United for Puerto Rico Fund, which is again made up of community business leaders that were mostly Puerto Rican, we thought that we were going to raise $1 million for the island, and everyone saw the devastation that Puerto Rico was in, just not in terms of building the infrastructure, but just no power. And so when we raised $1 million the first week with the support of the governor and the mayor and the Boston Foundation, we were so excited. But it just goes to show that, the public was watching and was seeing what was going on. And one of the difficulties was the federal response to what was going on. It just wasn't enough services and enough resources going to the island to really come back in a way that, the devastation wasn't so harsh. We had issues with food and with water and with medical care. I mean, you name it, we had issues. So we were so thankful that that Massachusetts just stepped up and for Puerto Rico in a big way. We were able to raise about $4.7 million of that. A great percentage went to relief and recovery in Puerto Rico. And then another percentage went to, unfortunately, the Puerto Ricans that were leaving the island and coming here to Massachusetts and their integration to Massachusetts and to life here.
Well, when you make the transition from Legacy Fund to Latino Equity Fund, change of name, it sounds like a different message and a different focus. So how would you define that?
So one of my colleagues says it really succinctly. He says, we can't leave no legacy if there is no equity, right? And we know that even before COVID, issues of health access and disparity and economic prosperity were challenges, right, that our communities were facing. And so we pivoted to respond not only to the challenges of COVID, but the challenges that the racial reckoning in the United States just lifted these issues for different communities of color, and ours was one. So our two areas of focus right now is addressing health equity and health disparities and around the economic prosperity, with a big emphasis on the not only the workforce, but English as a second language. So I forgot to mention this, Chris, but a couple of years ago, we did actually last year, in February, right before COVID, we did the Latino Equity Fund, at that point, Latino Legacy Fund, did a major report on why English language services pay, the return on investment. And one of the things we found in that report that only 10% of the programs were really focused on workforce programs for Latinos and others. And when you think about our community being so young and only 10% focused on that particular area, I mean, right there, that's a policy initiative, right? About how we look and work on that. So these are, again, COVID and racial reckoning highlighted a lot of these disparities that we already knew existed in our communities, and the work has just been accelerated.
Well, as you knew very well about COVID, one of the most glaring disparities was the higher rate of infection among the Latino population in the state, maybe many others as well. So you go out to East Boston with the van, you're in cooperation with Brigham and Women, Mass General. What difference did that make as far as getting people to be vaccinated?
Well, one of the things is, as another thing that was highlighted is that, and this report highlights it too, that I'm referring to, is that many people in our community are essential workers, and do not have the kinds of jobs where they can take off time and run to CVS and get a vaccine, or go. Many of them don't have primary care because the health disparities are not going away. And so this mobile vaccine gives people access to where they're at in their communities and when they can come, right? And it makes it much easier for them. Some folks, we learn, don't even have broadband or don't even have the ability to log on to a CVS or Walgreens and make their appointments. So this really talks about access and being in the community where you're at. The other thing is that, for people who are undocumented, Chris, it would be very difficult for them to feel comfortable to walk into, some of these institutions to get vaccinated. And this mobile vaccine, which is it's incredibly equipped, and it's culturally and language and everything, it makes it much easier for them and gives an incentive. And don't forget that there's a lot of misinformation out there going to many communities, but particularly the Latino community, around issues that the vaccine's not safe, that it's going to do this, that it's going to do that. So seeing folks in their community getting vaccinated right then and there in the mobile vaccine, and talking to some of the lay people who are helping, makes a huge difference.
One of the other things you're able to do is have a seat at the table around policy on response to COVID-19, even the messaging on vaccines. I saw some bad translations into Spanish around that. So I guess you knew there are better ways to do that.
Absolutely. One of the things that we did and it goes back to what I was saying about the policy pieces, that we lobbied through the Latino Equity Fund with the Latino Commission. Some members of the Latino Equity Fund are also on the Latino Commission, and a bunch of other of partners on the Latino community lobbied the governor around the issue of culture, because you can translate a bunch of things, right? But it has to be a culture component to it. And we were thrilled that the governor made an additional $4.7 million available for that. And we now have ASG working on the coordination. We have the DMV, which is the mobile, and we have El Mundo doing the whole culture campaign. Here's an organization, El Mundo, that's been working on media in Boston for the last 40 years. Why wouldn't they be the ones that best can send out the message to their community? So we're excited to have these three partners all working together on getting our folks vaccinated.
The other main focus you have here is economic recovery. A lot of businesses owned by people of color have been struggling with access to relief during the pandemic. What about the Latinx community?
Oh, absolutely. I mean, the figures are hard when you think about, one of the things that I saw, just taking a second back, is that the fastest growing businesses before the pandemic were women of color, particularly Latinas, right? The numbers have drastically changed. Those are the first businesses that are closing now. Why? Because they have families, because the kids are home, all these other influences. So our community has been hit very hard too, because some of them are still mom and pop operations, where if you don't have that family working in that business, it can really jeopardize your opportunity to continue to run it. So the Latino Equity Fund really wants to work on, economic growth for Latinos and the areas of entrepreneurship, to keep funding that entrepreneurship spirit we have, to continue to support some of those businesses that have taken a huge hit because of COVID, and on workforce development. Because one of the things that we found through the various reports that the Latino Equity Fund has done is that although our community is growing and we're still on the kind of bottom half of the workforce in terms of the skills. And so our focus also in the workforce program is to build those ESL skills. We found that through that report that many of the survey respondents said that they couldn't move up because of language issues. So some of our focus is going to be on the new ways to deliver language. And we're finding now that COVID has opened up this opportunity to do much more remote work. And that makes a huge difference for our families, because many of them sometimes have 1 or 2 jobs and just can't get to the classes. And the classes are sometimes not in their neighborhood. So looking at different and creative ways to reach our community through workforce programs is going to be vital. And we're so happy that the grant that we had, the $1 million that we received from State Street and from Eastern Bank, will focus specifically on that.
It's easy for people who don't live with us day in, day out to imagine that people who lack language skills, and at least to some degree, lack other skills. But we're really talking about people here, aren't we? About people who do have skills, aren't we?
Oh, absolutely, absolutely. So one of the things that the state of Massachusetts, I was on the workforce board, it did is look at the credentialing. So hence, in Puerto Rico, many of the ones that some of the professionals that came were medical professional nurses, but they had to take different credentialing, right? Which in a different language, and still, I mean, had many of them were nurses for many, many years. But the credentialing standards, I think sometimes skew differently. And one of the things that the Secretary of Workforce, Rosalind Acosta, did was really look at that and how it can impact and how we can have these professionals get credentials in a faster way. But they came with many skills. So you're absolutely right. It's not just skill sets, it's language, but let's not even go there. Let's talk about also access, right? And there are definitely, things that get in the way of workforce, and one of them is also discrimination, and just differences. I think I did an article for the Boston Globe, and I talked about this coded language that sometimes others use, and that coded language is in the workforce too. And so I don't want to diminish that part of why sometimes there are not those opportunities for Latinos.
And finally, Aixa, we should mention, people want to get some more information about the fund. Is there some place online where they can find that?
Absolutely. You can go to www. Latino Equity Fund at the Boston Foundation.
Thank you very much for taking the time to join us.
Thank you.
That was Aixa Beauchamp from the Latino Equity Fund. We'll have more news in just a moment.